My people, long time no see. Oh, whoops, I just dropped my phone. Happy to see y'all, bro. Man, I keep dropping my phone. I've been busy lately. Like, okay, as you guys know, my last video I made that was OT related is about me passing the board exam. And at that point, I feel like I'm on top of the world. Like, the world is mine. Everything's gonna be a smooth sailing. It's gonna be a breeze from here on out. And then reality hits. You got loans you gotta pay back. I mean, working the job is no joke, especially where I'm at. I'm at a skilled nursing facility, so I'm over here running from room to room to room. I'm exhausted at the end of the day. That's 8 hours on a good day. And a lot of other things. Of course, everything has its pros and cons. But overall, let me give you all my opinion of working as an OT, because I've been working as an OT since about May of last year, so it's been about 7-8 months. So I got my notes right here. I want to make sure it's a good video for y'all. So, working as an OT, a skilled nursing facility OT. Alright. So the biggest adjustment I had to make to this was the timing. So you're giving them roughly around 45 minutes to see a patient, but that's for you to do everything. That's going from the chart review to you signing off on a note and make sure they're back in the room on time. You going from room to room, having people dress, having to take them to the gym, put their leg rest on, and doing activities in the gym. It has to be all within 45 minutes. On top of that, you have to do your documentation, have progress. You know, if they have progress notes, that's like, you gotta set aside enough time. That's what I'm trying to say. So, you know, every minute counts. Trust me, you have to time everything. But it's a good experience, especially since I worked in a nursing home before for my field work last year. That definitely helped, because this job is definitely not easy. I mean, of course, my studying did good because we're working with several patients with dementia, Alzheimer's, COPD, ortho, hip replacements, all that type of stuff. You know, we get a wide variety of patients. So, I mean, I'm glad for my studying and for my rotation. Definitely prepared me for this, you know. And one thing that I do like to say is I really do like helping the patients out. Like, I remember one time I gave this patient, you know, me just simply just getting him a walker, and his face just lit up, and he, you know, stood up and grabbed it, you know, like, and then, you know, we're walking around with it, you know, you see the joy in his face. Those little type of things. Right? This other lady that, I know she had recently, you know, someone that, you know, her wheelchair got misplaced, and she likes to go out in the dining hall. So I was able to, you know, I found a wheelchair in an empty room for her. I was able to get her into the wheelchair, and she's been able to go back with her friends. You know, that type of stuff. It just, you know, it grows on you. I really like, that's something that I really like to, you know, it really makes my day. All right. So one thing I wish I would have known before starting, you gotta make sure you're safe when doing it. I'm not saying like, you know, it's like a dangerous like life or death type situation, but just talk about like having the proper body mechanics. Now, as we're all aware, you know, if you're anything medical field or therapy wise, you know that your back is the most precious thing that you could have while working there. Okay, you do not want to throw your back, because it's very easy to do, especially working in a nursing home. You always want to make sure you keep your back as straight as possible. But that makes things a little difficult, because some patients, like I said, are all different types of assistance levels. Some require max assist, some require no assist. But then the max assist, you gotta make sure that you're not doing all the work, because you might hurt yourself. You know, at the end of the day, this is your life that, you know, you want to do. You have to set the boundaries of what you're willing to do and what you're not willing to do. Even if a patient's too much for you, where you feel like you might hurt yourself, then, you know, get the mechanical lift, the Hoyer sling, and, you know, that's how you get them in the chair. Whatever it is to keep you and the patient safe. So for all you guys who just passed your board exams, it's time to start interviewing. So I wrote down 3 questions that I was constantly asked when I went to interviews. What made you go into OT? Now, everybody has the reasoning for what people go into OT. I've heard it all. I've heard it all from the sentimental stuff to I just want to make money. Whatever it is, you know, just make sure that it comes from, like, you know, you just like have a bit of honesty, but know how to word it right. Like, let me go into why I wanted to be an occupational therapist. Okay, so when I was younger, my grandmother, she had a giant stroke. It completely took out her functioning, her whole right side of her body. She was not able to use it. She was, you know, she went from able to, you know, drive me around when I was, you know, in school to, you know, now she needs help getting out of bed. So one day I was over at her house, and an occupational therapist that came over, And I just remember her, the occupational therapist brought the TheraBands over, which really caught my attention. I was like 13 at the time, but really caught my attention. And also when them doing the cooking activities and just, working on stand, it just really caught my interest. The belts are cool. I wish I had my belt here so I could show you guys. It's a really nice one. But that's what really caught my interest. And my grandmother, she made much progress. Like she went, she's able to walk now, or at the time she was able to walk. And, she definitely made big strides to where she once was. So that's why I wanted to go to the occupational therapist. But of course, everybody has their own different reasoning for that. So just make sure you know how to frame it and word it right, and know when to bring it out when necessary. Alright. So, but then what I want to talk about now is the interview, the types of interviews you might be given. Because coming from an interview, you really know, if a place is a good setting for you or not. Good setting for you, or if it's not. Like, for example, here, like this place. So let me give you an example of this one interview I went to. I went to this one interview, this one setting. I walk in there, there's like four people waiting at the table for me. I'm overthinking. Now, I'm usually used to 1 or 2 people, but 4, come on now. That's like, I don't know, I didn't like it, but I went along with it anyways. And then also during, throughout the interview, they're throwing, and I'm not gonna lie, this interview was tougher than I expected it to be. They're throwing out, really just, rare scenario questions that I never really thought of throughout the time. So, and it took me a minute to get my thoughts together how I would answer the question. And it just came, when I was telling them this, they were, my answers to response to the question they had, like, oh, what'd you do with this patient that was difficult, that patient's difficult, family members, all that. So I'm explaining myself, and I just, I saw, when I was explaining to them, they kind of had, an emotionless, expression, kind of like, yup, So I came to the point where I'm thinking, are you guys even listening to what I'm saying? So, I knew that wasn't going to be the best fit for me. I also, I did end up getting that job. I mean, everything happens for a reason, right? But there are other good interviews, I know where I'm at right now, everything just went so smoothly because I know that they're, big into, if a stroke patient came in and, from my grandmother suffering from a stroke, I was all in for, the questions. I know, what I saw her do when she had her stroke. So, interviews, it comes, you have good ones, you have bad ones, you just know what to look for. You'll get a vibe for the place during it. So, sometimes it ends up happening for the better. Alright. So let's get into what y'all really came here for. Let's talk about money. Salaries. So the biggest change of working as an OT opposed to a student is you finally get paid. So let's go through the settings about which one, is right for you, or, your whatever setting you're thinking of, what the pay is going to be like. So first I want to start with the hospital. This be acute inpatient setting. So I did an interview for a full-time, and I'm also going to break down the difference between full-time and PRN. PRN is basically, you come when you want to or when they need coverage. PRN, per diem, I think is what it's called, something like that. But so I interviewed at a hospital, really a small hospital, for a full-time position. They offered me $30.50. So, that's the only hospital I was given an offer from. So that's what I'm thinking. That's my basis, the baseline what I could give you guys for a salary there. I mean, some hospitals, maybe the bigger ones, I'm not sure, they might pay more. I just know hospitals, especially if you're new to the setting, you're a new occupational therapist, you're going to be at the bottom of the totem pole, which is fair because you're new, you don't have any experience. So that's something to keep in mind when you're going for a full-time in a hospital. Now I do work PRN in a hospital on Saturdays when they need coverage, and just time to time when they need extra OT help after my full-time job, I'll go to that job. So PRNs, those pay pretty well. I've heard anything from people start at 40 or 39 and go all the way up to 47. So I don't know why they pay the PRNs really high, and then I don't really know about the full-time. They're only giving one offer, so that's what I can really speak on hospitals. One good thing about working in a hospital though is, even though if I took that position, even though the pay isn't that well, you do get good medical and health benefits. Because I know it depends, for someone like me who's a type 1 diabetic, if you guys didn't know, that would come in handy. So we're going to pediatrics. Now, pediatrics was never really an interest of mine, so I've never done any experience or field work. I never even applied to any jobs for pediatrics. It's just not, that's just me. It's just not my specialty. It's not my interest. But from what I have heard, people who do work in pediatrics, I'm hearing like ranges between high 60s and then tap out at like 70K for full time. That's what I've heard for pediatrics. That's just from, what I've heard. I've never interviewed there. What I have heard is people say pediatrics is pretty like, it's exhausting because, running around chasing the kids and, having to deal with different behaviors. That's what I've been told when I ask people like how they like work in pediatrics. I'm not too sure about the health benefits that they're given. That's something I guess you have to ask somebody else for or to get, or, just something you look up on your own. That's really all I really know about pediatrics is pretty much the salary. I know hours. Hours can vary. I know some people, they may work, less than 8 hours one day, and then they work like 10, 11 hours the next day, take their work home with them. That's just what I've been told. So, like I said, that's just what I know about pediatrics. Alright, so now we're going to my specialty, skilled nursing facility. Alright, I gave you guys a little breakdown earlier of what I do in the skilled nursing facility. It's pretty similar, honestly, to inpatient and acute. I guess the patients, when they first come, they're a little lower functioning than opposed to somebody who's an inpatient. So, but they do make progress as long as they're motivated to go. And you just gotta make sure you time everything right and really try to prevent falls. Try to prevent falls anywhere, but definitely in a skilled nursing facility because they're already so fragile, and that can set them back. It's crazy how like if you lay in, if you're in bed for about a couple weeks, you lose so much of your strength. You could go from like doing everything on your own to, you need help standing up. So that's why it's important for them not to lay in bed all day. But let's get into the money. Up to 38 an hour. So 34 to 38 hours what I've heard for skilled nursing facility. But one thing I will say about skilled nursing facility is the benefits aren't as well as it would be in the hospital, like when I say like the benefits, I mean like when you go to your doctor, your dentist, whatever, you pay a lower payment, like a lower copay rather. I think that kind of makes up for the lack of pay. I know in my job, if you want to turn to a 401k, they match, but yeah, health benefits are a little bit worse for a skilled nursing facility. So that's just something to keep in mind. And then also I want to talk about home health. And of course home health, the one con to that is you having to drive around from house to house. You don't know what you're getting yourself into. And also you gotta buy your own insurance, so that's also another downside. But of course, you're making the most money. And I think that's why they have them, they recommend that when you're in home health that you have at least 5 years of experience. But usually for someone that's hiring, they usually have 5 years of experience. So that's a breakdown I could give you guys for it. Right now I'm loving it right now. I love working as an occupational therapist. I'm exhausted a lot because I work 6 days out of the week, definitely over 40 hours, 45 to 50 hours, who knows. I'm learning a lot though. I'm in 2 different settings. I'm in a skilled nursing facility and I'm in a hospital, so I'm liking that, It wasn't all glamorous like I thought it was gonna be. When I passed the exam, it's a lot of work is what I'm trying to say, Anything in life you want is a lot of work, but I'm still trying to learn, Also, I don't know if you guys noticed, but I actually got a new camera now, So that's one thing I love about being an OT.